Hello, this is Dr. Lewerenz at Longevity Health Institute. I hope this finds you well. Listen, today something hit me that was kind of pretty impactful, and I want to share with you because I've seen this technically year after year, usually a few times every few months, and that is when somebody is seeing a practitioner not getting a result, but they haven't had true medical conditions and diseases ruled out first. Okay, now remember, there can always be many truths. And what I mean by that is everybody's looking for the one answer. It's not always the case, okay? We deal with a deep dive 6-point model here. You've heard me talk about and why it's so important, but there may be a few things going on at once. But the first thing, not just in medicine, that we do no harm first, okay? The Hippocratic Oath. But the other thing is that we have to rule out bad stuff first. So I had somebody here today that's fairly new with me. I've only seen her a few months. And she is hung up on some condition like mold, okay? And molds and viruses and autoimmune stuff and infections, these are real parasites, these are all real. But here's the thing that you gotta take home, is sometimes other practitioners and people they've seen and they've done some work with, they have not ruled out underlying medical conditions that are very significant. Well, so here in our practice just a few months ago, I diagnosed her with an autoimmune condition. I likely believe that she has celiac, and actually even she has markers for lupus. The label doesn't matter to me, okay? What the label a patient has is sometimes irrelevant to me because it's just a label, and I always say this: don't be or become the disease. We just want to fix the physiology and the functionality of it, okay? But having an idea of why it's happening physiologically is very important. So we identified that. She has been told for years, hung up on mold, and you got to detox, and you got to, get super clean and blah, blah, blah. And that may have some validity, and she may have some mold. But she has not had structural things in her mid-50s ruled out that are very significant. And she has bowel issues and inflammation, gut issues, belly pain issues, severely, cramping and pain and fever, and even where her belly feels distended and bloated. She has not had a colonoscopy. She has not had a EGD, a scope where they look in your stomach, okay? And now, mind you, a few visits here, we've just ruled in autoimmune disease. We've ruled in likely lupus. We're going to correct those and stabilize her immune system. So in a natural way, she'll be functioning much better. But immediately I got her set up for a stat CT of her belly because this weekend she had fever, significant abdominal pain, literally where she couldn't get out of bed, and eventually it passes. But we always have to rule out the structural issues, the diseases. If you're practicing a form of medicine, okay, and you're calling yourself a medical practitioner, or if you're out there listening and you're seeing somebody that isn't an MD or a DO or have a medical license, you better as well get in to get one if you have significant symptoms and you've not had the big stuff ruled out. Mid-50-year-old needs a deep evaluation, a colonoscopy, and endoscopy, obviously lab tests, potentially a CT to rule out pains, okay, and them not just be labeled some alternative or suggestive diagnosis, okay, which, albeit may be true, there can always be two truths, but I do suspect in her that we're going to find diverticulosis, diverticulitis, something with her gallbladder, etc. These are very significant real things that can be overlooked, and she has wasted, by the way, these are her words, 2 years in another practice where she's taking a multitude of supplements, got nowhere, and even at times gotten severe abdominal and belly pain. So my point here is this: seek good care. But don't forget, if you're looking for a natural or a physiologic fix, call it alternative fix or a complementary fix, CAM type of a medical approach, which is non-traditional, rule out the traditional stuff, okay? Don't dismiss the traditional Western allopathic approach just because you wish a natural alternative holistic approach, okay? That's why we do integrative medicine, okay? Why these can work very well together, but do no harm. And I want you to take this to heart, because as we age, structural physiology things can happen, like diverticulosis, diverticulitis, cholecystitis, which is gallstones, renal disease, polycystic kidney disease, kidney stones, etc. These can get complicated when we're giving somebody a functional medical diagnosis, okay? So first of all, rule out the bad. Got to rule out all the bad stuff first, so that as we treat you and we fix you, we've not missed anything. So if I seem strong and emphatic in what I'm saying, it's because this poor lady has spent 2 years in another practice, a lot of money and a lot of suffering and time, and I think we'll get her on the road here very soon to improving her health and truly fix her autoimmunity, which you've seen other videos of mine, and how we fix and stabilize autoimmune disease. So if this doesn't find you well, let's get you better. This is Dr. Lewerenz, Longevity Health Institute. Be well.